Good afternoon, my name is Grace McDaniel, and this is my project on diagnostic ultrasound of the ulnar collateral ligament, or the UCL, of the first metacarpal phalangeal joint. First, let's discuss the anatomy surrounding the ulnar collateral ligament. There are two bones of importance, the first proximal phalanx and the first metacarpal. There are two ligaments which medially connect the two. This is the proper and accessory UCL. The proper UCL originates at the dorsal 1/3 of the metacarpal head and inserts into the proximal volar aspect of the proximal phalanx. The accessory UCL originates at the volar surface of the metacarpal head and inserts into the ulnar border of the volar plate. The patient should be seated with a pronated forearm so the palms are downward. The fingers should be spaced out to allow room for the ultrasound machine to make contact with the medial aspect of the first metacarpal phalangeal joint. Additionally, the transverse scan is traditionally utilized with the notch facing superior of the joint. To begin the procedure, ultrasound gel should be applied as a medium. The examiner may orientate themselves by spotting the hyperechoic surfaces of the proximal phalanx and the first metacarpal bones. Between these structures is the UCL. Additionally, the examiner may add dynamic movement to assess the integrity of this ligament. As you can see, the patient's UCL is intact and has great tensile strength. Above the yellow highlight is an example of the hyperechoic surfaces of the proximal phalanx and the first metacarpal. Above the blue is the UCL. Now, let's review. There are two components to the UCL. These are proper and accessory ligaments. To assess them, have a seated patient pronate their forearm so the palm is face down. Additionally, their fingers should be spaced to allow room for the transducer. You can easily view the UCL using a transverse scan and applying dynamic movement to assess the tensile strength. If you are well trained, ultrasound can be a great modality to rule in or out UCL tears. Finally, this is a list of references utilized in this PowerPoint.